Hey everybody, today we're going to be going over Chapter 40, discussing patients with special challenges. In this chapter we're going to go over ways that we recognize these type of patients. We'll go over some sensory impairments and cognitive and emotional impairments that patients may see, paralysis, obesity, as well as homelessness and poverty. We'll also discuss some of how to deal with patients that have been abused, human trafficking, violence, over some medical devices that you might see working in the field, such as vascular access and ventricular assist devices, vagus nerve stimulators. We'll discuss how to deal with terminally ill patients, dialysis patients, um, as well as intraventricular shunts. Now, patients' primary care provider or providers are usually well versed in the equipment or technology used, that they may not be as well trained in what to do if that equipment fails or if the patient's status begins to deteriorate. So it may be necessary to work closely with a specialty hospital in your area to better understand the constantly emerging technologies that we will see in the field. During this lesson, you will learn about these assessments skills needed, as well as emergency care for patients with a variety of special challenges. You have to be resourceful, excuse me, when dealing with patients with any type of disability to ensure that you're able to provide effective emergency care. We don't have a set base. We don't do it ABC every time. We may have to go ACB or ADBCFED, and work around what our patient. Every scene is different. Every patient is different. So we adapt our assessment to that patient. Sensory impairments can be anything from issues with the patient being able to hear, be able to see, or even be able to speak. And this can be issues for us because it can cause issues with when we're trying to communicate with our patients. Now, there's ways that we can work to improve communication with these patients who may have some type of deficiency, such as hearing impairment. This is when they are unable to hear. Deafness is the actual term used to be unable to hear. Um, it may involve one or both ears. If the patient is partially deaf, they may still be able to hear certain things. You just have to speak up a little bit louder. Or they may have a hearing aid placed as well. If they are totally deaf, we're going to have to find ways to work around that. For example, I have a patient that we used to go to quite often in one of the services that I used to work at, um, and she was completely deaf. So when we would try to communicate with her, she could read lips, but you might have to repeat it a couple times in order for her to understand it. So usually, since we thought we could, work efficiently, we'd have somebody writing our messages out and then have her read it. Um, some patients know sign language, so if you or your partner or someone there knows sign language, you can communicate with them that way as well. Certain diseases, such as glaucoma, can result in an abnormal increase in intraocular pressure or the pressure within the eye that damages the optic nerve, thus resulting in peripheral vision loss and eventual blindness. Injuries to the eye can be caused by puncture or penetration injuries, blunt trauma to the face, or chemical and thermal burns. This type of vision loss is usually acute but may not be permanent, depending on the degree of trauma endured by the eye and associated structures. Now, disease such as glaucoma, injury, or some type of trauma, as well as degenerative disorders, can cause vision impairment. In fact, a friend of my wife's, she has a rare disease that affects her vision, and her vision is gradually uh, becoming less able to be seen. So she cannot see anything if the lights are dim. Um, she has no peripheral vision, and she is legally blind. Um, So that is something that we may come across as EMS providers. Speech impairment is when the patient cannot pronounce words very correctly. Articulation disorders caused by impairment of the tongue or other muscles needed for speech, called dysarthria, it prevents the patient from being able to pronounce words correctly. It can be caused due to a hearing impairment, learning words incorrectly, or some type of a stroke, disease, trauma that affects the speech cortex of the brain can all cause you to have a potential speech impairment. Language disorders can also occur when the patient displays an impaired or absent ability to understand the spoken word. This can result from congenital problems in children, hearing deficits, or inadequate language stimulation within early life. Many hearing impaired patients can read lips. So always try to position yourself in a position so that way your face is in clear view of the patient and the area is adequately lit. You may need to communicate in writing if vital information is unobtainable through oral communication. When dealing with someone who has vision impairment, the patient may insist on taking a service dog, if they have one, to the medical facility. Recently, there has been better accommodation of these needs. You must follow local protocol as well as service policies and procedures. If it is possible, transport the animal with you. Uh, if not, try to have a family member or possible police officer transport the service animal to the hospital. If you're having to walk them, have them place their hand on your arm or shoulder to guide them. Don't pull them, just guide them along. Walk at their pace. Ask questions in a way when dealing with patients with a speech impediment that allows the patient to answer in as few words as possible. Do not attempt to finish the words or statements for them, because this can typically frustrate the patient and tends to worsen the speech impairment. Allow the patient time to respond to your questions and utilize family or other communication techniques. Also, never pretend that you understood something the patient said when you did not. You may miss an important piece of information that would have an impact on how you would treat this patient. Mental or emotional impairments. When a patient has a mental impairment, such as psychosis, the patient has an issue with interpreting what's actually there. They may think that there are little green men running all over the place. So that may affect the way that they communicate with you. At the same time, if the patient has an extreme emotional dysfunction, they may not be able to focus on your questions or respond appropriately due to severe depression or even anxiety getting them very excited. Often, developmental disabilities involves the brain and causes an inability to learn at a normal rate. The problem may not be noted until the child fails to reach certain developmental milestones. This can involve multiple portions of the body and can interfere with how the body works. Can cause issues with their speech, behavior, language, as well as movement disorders. Autism, also known as autism spectrum disorder, is a range of neurodevelopmental conditions that are characterized by impaired social interaction, verbal, nonverbal communication, and restricted and repetitive behavior. It's due to a combination of genetic and environmental factors. You might find the family or caregiver reporting the patient has autism spectrum disorder, or ASD, Asperger's syndrome, pervasive developmental delay, or PDD, or pervasive developmental delay not otherwise specified, or PDD-NOS. These patients, dependent on how severe on the spectrum they are, they may not be willing to communicate with you. So you're going to have to work very hard with the family to um, try to figure out what's going on with this patient. When performing an assessment on a patient who has autism, or whether providing care or transporting a patient, some autism spectrum disorder foundation recommendations include moving slowly during your physical examination, just like you would with a child. Begin at their feet and work your way up to the head. Explain what you plan to do in advance of performing the examination. Explain where you are going, who will be with you, and what they will see. Speak using simple terms and language in a calm voice. Give your patient plenty of time to respond to your questions. It's not uncommon for there to be a 3 to 4 second delay after asking a question. Also, expect the unexpected with autistic children. They often ingest unusual things and get into things without the caretaker realizing it. Ask the caregiver the functional level of the patient. You can then ask appropriate level questions and provide appropriate level explanations. Stuffed animals and other things used for children can also be helpful with older adults with autism. If a caretaker is present, allow him to ask the questions related to your assessment, and if possible, allow that caretaker to ride with the patient to the hospital. Don't assume a nonverbal patient who seems to not be listening does not understand what you are saying. A nonverbal patient may be able to write or type a response to your questions. Some other accommodations for dealing with patients with mental, emotional, or developmental impairments would be treating the patient with respect, just like you would any other patient. Um, Ask the caretaker what's their normal behavior, what's their baseline. Always remain calm and use calm body language, because these patients may be sensitive to your tone. Although some impairment can be obvious when you first encounter the patient, others such as hearing and vision impairments may not be as readily evident. Always approach the patient as if all sensory abilities are intact, but remain alert for evidence that the patient may have some type of deficit. However, do not assume the patient has a deficit just because of their age. When dealing with patients with brain injuries, it can affect the way that they think, learn, their emotions, as well as motor function. It can be caused by anything from trauma, diseases, abuse, and it can cause either permanent or temporary damage. Cerebral palsy is an umbrella term that's used for motor impairments that result from some type of brain abnormality that arises early within development. The degree of impairment varies dependent on the severity of the abnormality, and there's difficulty in the patient controlling muscles, and they can have issues with stiffness as well as contractures. Most people with cerebral palsy demonstrate difficulties in controlling muscle function. Um, they may have facial grimacing as well as cognitive impairment as well. Brain dysfunction from head trauma is a debilitating injury that usually leaves the patient permanently dependent on outsiders for medical care. The dysfunction of the brain from the injury can result in problems in breathing, their heart rate, as well as blood pressure regulation. Depending on the severity of the injury, it can cause them to have permanent slurred speech, to all the way being unresponsive, not being able to breathe, and being dependent on life support. When dealing with patients with brain injuries, the care you render for this patient depends on the conditions for which you were summoned. Above all, remember to maintain a patent airway, ensure adequate breathing and oxygenation, and keep peripheral perfusion intact. You want to try to determine what the patient's baseline condition is and to look for any changes that there may be. Consider summoning ALS for a patient who is critically unstable or deteriorating, especially if there is equipment beyond your needs, beyond your scope. of practice, such as a transport ventilator or intravenous line. Patients with pre-existing brain trauma can also range anywhere from being awake and oriented to confused to combative to unresponsive. It's important to accurately determine their baseline and whether their current status is normal for them. Paralysis. These patients, this paralysis can be caused by a variety of different things, such as trauma or strokes. These patients are prone to a number of secondary issues, ranging anywhere from technology dependence to pressure sores if they're not turned properly, to possible infection of those pressure sores as well as other areas. If a patient is paralyzed in all four extremities, they are said to be quadriplegic. If the patient with quadriplegia has a spinal injury in the vicinity of C3 to C5, or if they are suffering from a neuromuscular disease, they may not breathe adequately on their own. If you are dealing with a paraplegic, make sure that you follow local protocols regarding the patient being able to be transported by wheelchair. If you have a vent patient, keep those settings as you find them. Do not mess with them. You may have to get ALS on scene to help support that patient on a vent. And be prepared to, if they have a stoma or some type of breathing tube, you may need to suction it out if a mucus plug or fluid begins to fill up in that area. Do not allow necessary tasks and specialty care distract you from the fact that you are probably called for some other emergency that you must concurrently attend to. So always keep your eyes out to see what's going on. The patient, so talk to family. They'll know exactly what needs to be done for the patient, how to move them, what equipment needs to be taken with them. If they do have a urinary catheter or a colostomy bag, make sure that they are secured at the proper levels for transport. Bariatrics, this is the branch of medicine that deals with obese patients. To be considered obese, the patient has to be 20% or more over their ideal body weight. They are considered morbidly obese when they are more than 50 to 100% over their ideal weight, or more than 100 pounds over their ideal weight. Table 40-1 in your book goes over effects that weight can have on various body systems. Obesity places a large demand on your body. Over time, this heightened demand can lead to serious medical conditions such as hypertension, sleep apnea, diabetes, and cardiovascular disease. Airway occlusion can be prevented in an obese patient by a proper positioning of the patient. If the patient is conscious, allow him or her to assume a comfortable position, usually sitting upright or in a slightly reclined position. If the patient cannot protect their own airway, ensure that the airway is maintained in a neutral position to allow airflow. When supine, the posterior thoracic wall in the obese patient has limited mobility, and the anterior thoracic wall is weighed down by the patient's adipose tissue, thus causing a rapid fatigue of the respiratory muscles can occur. It's also significantly more difficult to ventilate a patient weighing 380 pounds than a patient weighing 180 pounds because now you're having to ventilate for all that extra weight. So make sure that you pay close attention to, if you're having to ventilate for the patient, to your tidal volume, ensuring that you get adequate chest rise and fall. If you're having to lift and move an obese patient, make sure that you have the necessary personnel to ensure that you can adequately move that patient, to ensure that you don't get harmed in the process. Cot manufacturers are now designing what's called bariatric devices that include specialized cots that can hold greater weight, and bariatric loading devices such as special ramps and winches that interface with specially designed ambulances' cot locking mechanisms. So as you can see in this picture, they actually have I'm getting caught, uh, a ramp to take the patient up into the back of the ambulance. Um, and there's a winch device actually built into it as well to help support the crew loading the patient into the back of their truck. Homelessness and poverty. Factors that can contribute to homelessness include substance abuse, lack of housing, violence, mortgage foreclosure, um, natural disasters, uh, returning to society after being in prison and not being able to get a second chance. With these patients that are homeless, there are some risks involved. Um, because of them being homeless, they look to whatever means that they can to survive. So they're more prone to become violent and abuse. Um, so that way they can get whatever it is that they need. Also, because of them being homeless, they may not have adequate access to health care. So they're at an increased risk of illness. They're at an increased risk of depression because of discrimination. Because of the lack of a permanent residence or place for storage of their possessions, a homeless person must cart their belongings with them from place to place, for example in bags or shopping carts. They also have a hard time finding their way out of homelessness because many employers, if they know someone is homeless, they're not going to hire them. Because they assume that there's something wrong with them, that they're a drug addict, they're disease ridden. They don't know anything because they think that they have no education. Because of their exposure to the environment and lack of preventative care or any medical care when minor injuries or illnesses arise, the homeless person is at risk for even emergencies. Ongoing conditions such as poor nutrition, environmental exposure, lack of access to medication, and vulnerability to violent acts leave them at risk for cardiac, pulmonary, vascular, and traumatic emergencies. You may find these patients within abandoned buildings, unoccupied houses, homeless shelters, public places, abandoned vehicles, wherever they can, to find somewhere to get out of the weather. Like the homeless, people who fall below the poverty level are at great risk for illness and injury, partly from their environment, and partly from the lack of primary medical care, screening, and treatment needed to prevent the advanced development of disease. People lower on the economic ladder tend to suffer from higher rates of illness and death. If you spend any amount of time in EMS, you will undoubtedly encounter a homeless person at some point. Your duty to access and care for these patients is the same as for patients who are not as disadvantaged. One concern you may hear from the patient is that they don't have the money to pay for the ambulance or hospital bill. In this situation, explain to the patient that almost all healthcare providers offer a certain degree of reduced cost or free medical care. Alright guys, we're going to take a break here. When we come back, we'll pick up with abuse. So get up, stretch your legs, use the restroom, get something to drink, whatever you need to do.